Welcome to this short video where I'm going to discuss the different blade handles and blades used in oral surgery. I've got three separate blade handles here, and the first one I'm just going to demonstrate is this blue handled one by Swan Morton. Now this is a single unit, so it comes in a packet, entirely disposable, so the advantage is that you do not need to put the blade on or remove the blade. It's a standard number 3 handle with a 15 blade. They also supply them with a number 11 blade if required. The advantage is that you just dispose of the entire unit in one piece. The disadvantage is if you're used to a metal handle, these are a little bit flexible, so sometimes they don't feel as strong or as firm. And the second disadvantage is that this will increase your clinical waste, weight, and therefore cost. The more traditional Swan Morton handle here, which is a number 3 handle, which is a metal handle which you would autoclave. It does have a measuring ruler on one side, but also it's the more traditional flat handled. I'll show you in a second how to put the blade on and how to remove the blade. The advantage of this is that you can autoclave it so it's reusable, and you just replace whichever blade you want on the end, whether that's a 15, a 15C or an 11. I tend to use this more commonly, which is a round handled blade handle, and a variety of different companies make these. You can see how the blade will fit on the end quite nicely. It just allows a little bit more dexterity, I find. The two blades that I use commonly are either a 15 or a 15C. So this is the number 15 at the top, and this is the 15C. You can just see that it's a little bit thinner on the edge. In order to put the blade on one of these two handles, I would use a pair of needle holders. And you can see on the blade, I would hold it at the end and lock it. The blade, we've got that angle there, which matches the angle here on the scalpel. So in order to get this on, there's a little perforation. So just, if you can just see that, if I just hold that, you can see that it's just gone onto the blade handle, and as you pull it down, it will click on, and that's then solid. Same principle with the round handle. In order to remove this, turn the blade over, so you're pointing it down, make sure there's nobody in front of you. Just lift gently that bottom part of the blade and push down and away from you, and the blade will then come off. That can be then disposed of in the sharps bin. So just to reiterate that, hold the blade at the end, make sure that you've got the angle, so this is just going to come on about 45 degrees, slide it on, and then it'll click in. If it hasn't clicked in or it's not solid, it's not safe to use. And then to remove it again, just push down a little bit and away. There are some blade removal systems available out there where you just insert that into the yellow box, pull it out, and it removes the blade for you. I'm not aware of any systems that will allow you to do that with a round handle at the moment. The blades, 15, 15C, I used Swan Morton blades, and they're very good, and I've had no problems with them at all. So that's the standard blade that I would use for oral surgery, a 15 or a 15C. Additionally, in my kit, I tend to have this instrument, which is either called a molt or a boozer or a periosteal elevator. And this allows you to raise your flap on one end. This is quite sharp but very rounded, so you can raise a nice full thickness mucoperiosteal flap, and it's very light. On the other end, there is a pointed end just in case you want to release anything that's tethered. I also have a double-ended curette, which looks like this. This is quite handy for enucleating cysts or removing any pathology. And again, either of these ends, you can just get under that layer and peel it back nicely and dissect it off the bone. Very light, again, and double-ended. My retractor of choice is the Minnesota retractor, and I'll put a picture on how I use this. It's got two purposes. This more pointed shovel end, I guess, would go underneath your flap, so you can hold this, and I hold the very end of it like that, and I can use it as a fulcrum if I'm confident the bone is solid to either rest my handpiece on here or anything else. If you invert it and turn it round, if it's got a nice curve on the end, you can actually use that as a cheek retractor, very similar to a Kilner. So if you do require your assistant to pull your cheek out, to hold that while suturing, that can be used for that as well. More commonly, though, I tend to use an Optragate these days. Standard needle holders, some nice long thin ones to allow you to get to the back of the mouth, nice small tips. These instruments are mostly Hugh Freedy, but there are obviously other ones on the market. Very nice, light, and do the job very well. A pair of toothed forceps, again, I quite like a long, thin set of toothed forceps, so that allows you, if you are working quite posteriorly, that you don't have any issues. The smaller DeBakey's are also very useful, so again, it depends what kind of work that you're doing on a regular basis. I also have in my kit an artery clip or a mosquito, and that's just really handy for getting any little bits out or any fragments. I'm quite particular about scissors, and in some of these kits the scissors that come are these little iris scissors, which when they're closed they have a very sharp point on the end. Now, I'm not a fan of those because if your assistant is going in to cut your suture, if they do catch any soft tissue, that will actually cause trauma. So I don't like these. I also don't like the fact they're quite short, so if you are working posteriorly it's quite difficult. The ones that I tend to use are the Mackindos, which are long scissors. When they're closed, the ends are blunt, so you're less likely to do any damage with these. And again, you can get quite far back in the mouth to cut any sutures with those. So Mackindo or Mackindo, depending how you pronounce them. That's my general kit. I also have an instrument like this, which is a little bit like a periosteal elevator on one end, but also has a rather flat edge on the other end. Now, I tend to use this when I'm using PRF to flatten my membranes out, or sometimes you can just use it to retract a flap if you need to hold a small area of flat back. And that's my general oral surgery kit that I would use day to day.